scene. Okay, so Molly is being seen in the clinic today for a 1-month follow-up after being unilaterally implanted with a cochlear device. Molly has a medical diagnosis of Lyme's disease. The progression of the condition has ultimately affected her auditory system. Molly expressed difficulties hearing at restaurants and family gatherings, even after being implanted. She expressed that she feels frustrated and overwhelmed in overstimulating environments, such as restaurants. She is returning today because she's frustrated and disappointed in how her cochlear implant is working. She expressed that in the past month she has canceled plans and has isolated herself from social events due to communication, fatigue, and embarrassment. The patient is an advanced iPhone user and is motivated to learn how to live with her cochlear implant and wants to get back to her busy social lifestyle. So, hi Molly, it's great to see you again. I was reading through your report from the last time we were together, and I noticed that you have indicated some frustrations or concerns regarding your implant. So the goal of today's appointment is to address those concerns.
Hi, thank you for meeting with me today.
Yes, absolutely. So at our previous appointment, we talked about realistic expectations and the timeline of what to expect with your prognosis using your device. So at the last appointment, we set sounds to be at a comfortable level. Do you think that the sounds are still at a comfortable level?
Yes, I have not experienced any negative side effects due to loudness level.
Awesome. So the goal of today's appointment is to kind of continue to build off of previous testing and kind of like fine tune your device to meet your individual and specific communication needs.
That all sounds great, but how do you do that?
So it's going to be super similar to what we did at our last appointment, and that I'm going to use the cochlear software and make some adjustments to give you better sensitivity to loud and soft sounds, ultimately with the goal of improving sound quality. So I'm going to grab my laptop and do that right now. Okay, awesome. How do those sounds sound to you?
They sound good.
Awesome. All right, so next we're going to talk about some communication strategies that you can implement in your personal, social, and professional life. So those kind of include using like an online chatting, messaging format at work. I know that in the work setting you work in now, it's more of a cubicle set space, and it can make it difficult for you to hear your coworkers around the office. So things to consider is to also use online messaging, and then maybe even have a conversation with your coworkers about not talking across like corners and halls and things, and that actually like having face-to-face conversation is super beneficial for you, not only you, but also your coworker as well. Another thing to consider, I know that you're an advanced iPhone user, and linking your device not only to your personal cell phone, but also maybe if we can work through linking it to your work phone, so you can actually get those incoming calls on your work device as well.
Okay, I will start doing that. I've recently been taking off my cochlear implant when I get home from work. I figured that when I am by myself, I could just rely on my good ear.
Yeah, so I also noticed that in your data logging that you were wearing your device for about 10 hours a day. Ultimately, we like the eyes open, ears on mentality, and that any waking hour of the day, we like for you to be wearing that device. So even when you're at home by yourself, while you're watching the TV or talking to someone on the phone, I encourage you to wear that device at all times, because it just gives you the most access and exposure and experience to sounds with that device on.
Okay, that sounds good. I'll start doing that.
Awesome. So now I want to put this conversation into paper, and I want us to write down some goals that we can set and have it, that we can set some goals for certain listening situations.
Is there anywhere I can write this down?
Yes, absolutely. I'll have you write them down here. So ultimately, I want you to pick 3 situations, and then 3 situations or 3 environments that you would like to improve on your hearing needs. So whether that be like, 1 could be like in a restaurant setting with friends, and then 2 could be at work, having that conversation with your coworkers about effective communication strategies on both ends. And then our 3rd goal could be to increase your wear time of your device.
I did think of a question. Will there be any negative side effects to the adjustments that you made on my cochlear implant today?
That's a great question. So the fine-tuning adjustments that were made today were ultimately made to improve or increase your overall sound quality perception of soft, medium, and loud sounds. So I don't expect there to be any adverse effects internally or externally to the changes that we made today. Also, I wanted to recommend, I have a brochure over the Cochlear Copilot app on your phone. This app really helps patients to improve their listening and communication skills. I'm also going to include a couple websites that I wrote down on here to check out as well. It just gives a lot of like great tips and strategies for talking through communication environments and how to have those conversations with family members and friends. And then also on the website, there are a number of like auditory training exercises that you can kind of dig into and see if any of that is of interest to you. Ultimately, the app and the website just provides a lot of great resources that a lot of our patients have said have been very, very beneficial to them. And I'm also going to include my business card as well. I know you already have a copy of this, but just in case that it gets lost in translation sometimes. So ultimately, I see that you are a very motivated cochlear implant user, and that I hope we addressed the concerns that you were having today. For follow-up, I would like to see you again in 3 months, and we can continue to make any fine-tuning adjustments and address any other concerns that you have. Do you have any other questions for me today?
I think you have answered all of my questions I have at the moment.
Awesome. Well, it has been a pleasure seeing you again. I look forward to seeing you again in 3 months, and we'll just go up to the front and schedule that follow-up appointment.
Thank you.
Yeah. And scene.
Nice.